All righty. Well, hello, everyone. Happy Friday. Hope everyone is doing well. All right. So today I am going to answer questions related to thyroid health. It won't be a long session. Last week I was on for about an hour. So today it'll be less than that as I am getting ready for my 5-day Healthy Gut, Healthy Thyroid Boot Camp, which hopefully you're registered for. I'll be bringing that up in just a minute in case if you're not, if you're for those who are not aware of it. So first of all, let me just quickly go through resources for those who are not familiar with my podcast and website. So my podcast, SaveMyThyroid.com. As I mentioned here, a little bit more of a focus on hyperthyroidism, but most of the episodes will benefit both people with hyperthyroidism or Hashimoto's, especially the guest interviews, but even most of the solo episodes. But when I do a solo episode, more times than not, it focuses on hyperthyroidism, Graves' disease, just because most of the other podcasts out there focus on Hashimoto's. But if you do have Hashimoto's, again, there's plenty of content on there as well. And then naturalendocrinesolutions.com. So SaveMyThyroid.com is only about 3.5 years old. When I released my podcast in 2021, that's when I came out with SaveMyThyroid.com. Naturalendocrinesolutions.com has been out for almost 15 years. It's been over 15 years since I've been in remission from Graves. And then not too long after that, in 2009 is when I've been in remission since 2009. 2010 is when I launched naturalendocrinesolutions.com. Has hundreds of articles, blog posts for those with, again, both hyperthyroidism and Hashimoto's. Also have a supplement line, thyrosave.com. And then I have 3 thyroid-related books. First one, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, released originally in 2011. Third edition came out in fall of 2023. Hashimoto's Triggers, released in 2018. And the Hyperthyroid Healing Diet, my most recent book, released in spring of 2024. And then my YouTube channel, you can either search my name or you can just savemythyroid.com/YouTube. I also have a quiz, savemythyroid.com/quiz. And then as far as the announcements go, so on Monday, January 20th, I'll be kicking off my free 5-day Healthy Gut, Healthy Thyroid Boot Camp. First time I'm doing this in almost 2 years. Spring of 2023 is when I last did this. So it will be the only time this year. Not sure if I'll do it next year. Usually I like to rotate. So if I do it again, I mean, I won't rule out next year, but the way I've been doing it again is like every other year. So if I do it in the future, again, it might not be released, or I might not go live again with this topic for another couple of years, 2027, which, don't even want to think about 2027. So the time goes by so fast, but I don't want it to go by that fast. So the 5-day boot camp includes 5 daily live lessons, followed by a Q&A Monday through Friday. I will be rotating the times in order to accommodate different time zones. So Monday, Wednesday, Friday, I'll be at 1 p.m. Eastern time. And Tuesday and Thursday will be 8 p.m. Eastern time. And there'll be like a daily assignments, engagement with others, prizes for participation. For those in the Facebook group. If you're not in Facebook, then you don't have to participate. So far, we have over 700 people registered. Not as many in the Facebook group. So the Facebook group has like 50 something people, but I think by the end of the weekend, we'll have at least a few hundred. Obviously, we're not going to have everybody in the boot camp participating in the Facebook group, but usually we have about a third. So if we have, let's say, like 900 scheduled, which at this rate probably will be around that. Probably like the hope is at least 300, but maybe even if we only have 200, that's still pretty good in the Facebook group. But anyway, the least amount of people in the Facebook group, the more opportunity, the greater chance you have for prizes. So if I was in a Facebook group, I actually would be like, hey, might be a good idea. I might be happy if there's not a few hundred people in the Facebook group. But like I said, right now there's a little over 50 people in the Facebook group. There is an optional VIP upgrade. So when you visit savemythyroid.com/healthy gut, that's completely free. And then when you register, you'll get a VIP upgrade page. So if you reach that page, that means that you are registered for the free boot camp. And I bring this up because some people see the VIP page and then they get confused. They're like, wait, is this not free? It is free, but again, you have for $27, there's an optional upgrade where you get a year access to the recordings, a dedicated Q&A session where you could email questions ahead of time. So, yep. And that's it. So let's, again, maybe like I'll go until 2 p.m. So like 25 minutes if there are that many questions. And again, if I don't get to all questions, then next week, show up at the Healthy Gut, Healthy Thyroid Bootcamp. And if I get to all questions, again, yet last week, I got, I think, to all, if not most questions. And like I said, I was on for an hour, but I still have a lot to do for the boot camp. So I'm going to just back up for those who trickle in late so they could see this slide talking about the boot camp. And let's go ahead and start off with our first question from Diane. So, hi, Dr. Eric. How important are optimal antibodies and TSH to get pregnant? Do you strictly recommend to have everything in optimal, normal range, like free T3, free T4, TSH antibodies when trying to conceive? If a woman got pregnant with elevated antibodies and TSH under 0.005, what is the usual behavior of hormones? Will they go crazy? More likely the opposite. Thank you. Yeah, I do have. I mean, I actually have Save My Thyroid Health audit where I spoke with someone who was was pregnant when dealing with Graves' disease, and I've worked with women who are pregnant. I mean, the ideal situation, like there's definitely an increased risk. There's an increased risk when someone has imbalances in thyroid hormone and antibodies. I mean, when someone has when their thyroid hormones are in imbalance, it's less chance of conceiving. So, and then when you have increased antibodies, there's increase of miscarriage. And this is coming from, I think it was Dr. Amatma Simmons, who fertility expert who was on the podcast, and she spoke about this. So, like she doesn't, like, her goal is not necessarily to get the antibodies completely normal, but I mean, that's not, I shouldn't say that. That's maybe her goal, but like if she's fine, like if she's working with someone and their antibodies aren't normal, I mean, her goal are all from a functional medicine standpoint, we all should be striving to get patients to where their antibodies are normal. It's just not always easy to accomplish that. So yeah, it's not that woman can't have a successful pregnancy with TSH, low TSH, elevated antibodies. I mean, more important than the TSH, of course, is the thyroid hormones. The TSH is just the pituitary hormone, and not to say that it's not important, but if the thyroid hormone levels are elevated or depressed, or even like less than optimal, then yeah, then that's risk to the baby. Even if you are able to conceive, you don't really want the hormones to be too high or too low. And again, the antibodies themselves, you could have successful pregnancy with elevated antibodies, but it does increase the risk of miscarriage. So if you can focus on this before getting pregnant, great. That's not possible with everyone, which I completely understand. All right, so okay, the boot camp. Will the boot camp be on YouTube? So no, the boot camp will be on Zoom. It's not. This is the way it's. Yeah, it's not going to be broadcast like this is, like on Facebook and YouTube. It will actually be on Zoom. People have to register to attend because yeah. So it's a completely different format. It is live, but it's a Zoom call, and if you're unable to attend, it'll be recorded, but it won't be live streamed to YouTube or Facebook. All right. So Floor asked, do you have a general guide for taking bugleweed and motherwort tincture for hyperthyroidism? No, I don't really have a guide. I do have a podcast episode recently that I released, like how much bugleweed should I take, and I might talk about motherwort as well. I mean, motherwort is more dependent on the symptoms. So with motherwort, like you could, like, again, I'm not giving specific recommendations, but someone could always start with like 2.5 milliliters once or twice a day and see if that's helping with the cardiac symptoms like the heart palpitations. And if not, they could always increase. Bugleweed is more dependent on the thyroid hormones. And so I definitely would check out the podcast Q&A episode. Visit savemythyroid.com, type in, do a search for bugleweed, and you should find the episode, how much bugleweed should I take? And I put together that episode because it's a common question, just like you're asking. I don't know if I have it in a written format. I don't have a guide. I know that. But if you visit my other website, naturalendocrinesolutions.com, and type in bugleweed, I might have some articles where I talk about general dosing guidelines. All right. And again, if anybody trickled in late, next week, 5-day Healthy Gut, Healthy Thyroid Boot Camp, starting again Monday, January 20th. The website, savemythyroid.com/healthy gut. And speaking of the boot camp, Jane Elizabeth says, hi, Dr. Eric. Can't wait for the boot camp. Neither can I. So diagnosed on February 2024, Graves, hyperthyroidism, started 10 the methimazole, so 10 milligrams of methimazole, reduced to 5, and then 2.5 milligrams of methimazole. Was feeling much better by October of 24, had lots of stress through the end of the year. Current labs, TSH 3.46, free T4 1.17, free T3 3.4. So, I mean, thyroid hormones look really good. Okay. Free T3 is 3 point. Yeah, thyroid hormones look great. TSH a little bit on the higher side. TSH receptor antibodies or TRAb 1.49, TPO greater than 600. So TRAb started at 2.35. So I felt was moving in the right direction. Had TSH down to 1.83, and it popped up between October 4th and January 25th. My endo and I, all right. You might have to continue. So with unfortunately with StreamYard, it doesn't it cuts off the questions. So I'm not sure what your question is, but I will say it's great that you're down to, I mean, assuming you're still on the 2.5 milligrams of methimazole, real low dose, that's great. And yeah, I mean, still obviously want to work on the antibodies, and so definitely think you'll benefit from the boot camp I'm having next week. So okay, let's see. Did she? Okay, so my Enzo and I don't see eye to eye. She said I should stop 2.5 milligrams of methimazole and see what happens. Since I've been on methimazole for a little over 12 months, I said that I should stay on 2.5 milligrams of methimazole and continue to work on lifestyle changes and add back therapy with 25 micrograms of levothyroxine. She does not believe add back therapy, also known as block and replace therapy. I don't know what to do. I was afraid to stop methimazole and lose all my progress. Haven't found another Enzo. Would prefer to go natural route moving forward. Is there, I guess you're talking about supplements. I mean, bugleweed is what I took. If you can't get a prescription, again, I can't tell you, of course, to stop the methimazole, but I took bugleweed along with motherwort. Bugleweed is the main one that focuses on the thyroid hormones. And so that's what I took. And that's what a lot of my patients take. But I do have some people on antithyroid medication, such as methimazole or PTU. I mean, I agree with you. I would be nervous about stopping the 2.5 milligrams. And yeah, with block and replace therapy, you'd add a little bit of the thyroid hormone to, but I will say this. I mean, the TSH is high, but the thyroid hormone levels look good. So it's one of those things. Well, do you need to take the, do you need block and replace therapy with the, with the thyroid hormones looking as good as they are? I mean, if you're feeling hypo symptoms like more fatigue or coldness, weight gain, then maybe. But and then, supplements, if you are asking, like, is there a natural supplement like thyroid hormone? I mean, there is like Thyrogold. Thyrogold is one that's like a natural, like a over the counter you could buy online, like desiccated thyroid. So, but yeah, it's I can understand not seeing eye to eye, and yeah, cold, fatigue, weight gain happening. Yeah, so I mean, I would say just either work with someone else, whether it's another endo or another functional, or not another, but a functional medicine practitioner who has prescribing rights and can prescribe not only the antithyroid medication but the levothyroxine. So, yeah, that's what I would recommend from a symptomatic standpoint. Or again, maybe make the switch. Again, I'm not telling you to stop it, but work with someone to make the switch from methimazole to bugleweed, which can be really effective, but maybe won't make you as hypo, even though, like I said, the numbers don't indicate you're crazy hypo, like just your TSH a little bit higher than we'd like to see. But the thyroid hormones, at least now, are looking good, but who knows what the next blood test would show. All right, Nancy says, how can I get my energy back up with Hashimoto's and Graves' disease, but my thyroid was killed off by radiation? Well, I mean, from a thyroid perspective, again, you probably need thyroid hormone replacement. I Not everybody needs thyroid hormone replacement, but if you got radioactive iodine, or if someone gets thyroid surgery, then, especially thyroid surgery, complete thyroidectomy, then someone would need thyroid hormone replacement. Radioactive iodine, it depends, but many people do need to get to be on thyroid hormone. But if you're already on thyroid hormone, and let's say your thyroid hormones are optimal, so that's what you're trying to do. Number one is make sure you have optimal T3, optimal T4, optimal TSH. And then if you're still experiencing fatigue, a lot of other factors can be at play. So you could have problems with the adrenals, blood sugar imbalances, problems with the mitochondria. You could have some type of infection going on. So again, there's a nutrient deficiencies like iron deficiency, B12. I mean, so more detective work very well may need to be done, assuming your thyroid hormone levels are optimal. And if not, then you need to work with someone to get them optimal. All right, and we've had some more people trickle in. So again, just before I get to the next comments or next question, 5-day Healthy Gut, Healthy Thyroid Boot Camp will be starting Monday, January 20th. SaveMyThyroid.com/healthy gut. Once you register, there's an optional VIP, but if you see that page, that means you're all good to go for the free boot camp. Again, the VIP completely optional. So Bree, all my lab work comes back normal except for my antibodies. They are very high. The doctors say I'm okay, but should I get another opinion? I mean, most medical doctors, including endocrinologists, don't pay much attention to the antibodies, even though Graves and Hashimoto's are immune system conditions, but they're more focused on the thyroid. So I just released on my podcast, if you visit SaveMyThyroid.com, I have a 6-part series that I just released. The 6-part just came out this past Tuesday on lowering and normalizing thyroid antibodies. So yes, I would say, based on me taking the time to release 6 episodes focusing on lowering thyroid antibodies, I think it's important, and it would be a good idea to get another opinion. Just keep in mind, if you get another opinion from a conventional doctor or endocrinologist, they're probably going to also say, don't worry about the antibodies, because the majority of endocrinologists will say, no, we don't really worry. We're not really concerned about the antibodies. So, Elizabeth Ann, do you have an opinion on EBV, Epstein-Barr virus, being a root cause for thyroid disease? I mean, it definitely can be a factor. It definitely could be a trigger. Some say that it's the main trigger, and I don't know. I don't think that's necessarily true. I mean, the thing about Epstein-Barr, once you have it, you have it. You can't get rid of it. So you're really trying to live in harmony with EBV. You're trying to optimize your immune system, so you could, again, live in harmony with Epstein-Barr virus. But that being said, yeah, viruses definitely could be a trigger. Not only Epstein-Barr, but during the pandemic, we saw a lot of people come in, especially with hyperthyroidism, a lot of Graves' disease cases, some subacute thyroiditis cases, and Epstein-Barr virus also could be a potential trigger. Okay, JF, for how long is it safe to be on bugleweed? I mean, there's nothing in the literature about safety studies with bugleweed. I personally was on bugleweed for 9 months when I dealt with Graves, but I've had patients in some cases take it over a year. And I mean, there are people who, unfortunately, they don't do anything to address the cause of the problem, but they just take bugleweed. And there have been people that I know that have been taking bugleweed for years, and it doesn't seem like it has any negative effects on their liver enzymes or kidneys. And that's what you would monitor, just like if someone is taking any type of medication, do a comprehensive metabolic panel or just a separate hepatic panel, separate liver panel, look at the kidneys. And it seems like it's fine to take long term, even a few years. But like I said, if you look at the research, you probably won't find anything on that. And Jane Elizabeth says, excellent, thank you. I would love to switch to bugleweed and work with a functional practitioner. Will you discuss how to work with you either now or during your boot camp? Yeah, towards the end of the boot camp, but I won't make you wait that long. Yeah, like the first few days, I'm not gonna, but towards the end, I will, because inevitably people, when I do these live events, people ask. So like probably like the last day, I'll spend a few minutes talking about it. But you could, if you don't want to wait, what I would do is visit workwithdreric.com. We do require everyone to watch one of my free webinars to learn more about me. And also I talk about working with me, and there's the fees and everything like that in the webinar. And then if you have any questions, you can reach out to my assistant, Kate, staff, STAFF at naturalendocrinesolutions.com. She's off on Friday, but she'll be back on Monday. But yeah, so that's what I would recommend, is to check that out. So yeah. All right, let's do I need any medication for goiter? This is Divine, and she says, my doctor said I don't need any medication. With the goiter, so goiter is an enlargement of the thyroid gland, and you want to address the cause of the goiter. So if you address the cause of the goiter, I mean, like when I dealt with Graves, I had a mild goiter, and I took bugleweed, which was not specific for the goiter, but specific for the hyperthyroidism. So I took bugleweed, which lowered the thyroid hormone levels. And then over time, it took a couple of months, but the goiter did decrease and disappear. Now, again, in my case, it was a smaller goiter. When they're larger, it could be more challenging and definitely takes more time. But so it depends on the situation. If you have hypothyroidism, some people with low thyroid hormone will develop a goiter. And if you have low thyroid hormones, you wouldn't want to take bugleweed, because bugleweed would lower the thyroid hormones even more. So in that case, someone might need thyroid hormone replacement. So it really depends on why do you have a goiter. All right, so Karen, best treatment, external and internal, to clear up skin rashes. I've had them for 6 months with hyperthyroidism and Graves' disease. So I interviewed on the podcast Dr. Julie Greenberg, who's a naturopathic dermatologist. And so what she mentioned, and I agree with her, that pretty much when you have skin rashes, it's gut related. It's immune system related, but most of the immune system cells are located in the gut. So there's nothing really specific I could say to take, because it depends on what's causing the gut issues. And just by coincidence, next week, we're going to have a healthy gut, healthy thyroid boot camp. So we're going to talk about maybe not specifically rashes, but how to heal the gut. And as a result, how to heal. It's called Healthy Gut, Healthy Thyroid, but really healthy gut, healthy immune system, healthy thyroid. That would have been just too long of a boot camp name, but really by healing the gut, we're optimizing the immune system and helping with the thyroid. And then even if someone has a non-autoimmune thyroid condition, such as toxic multinodular goiter, having a healthy gut is important for other reasons. Same thing with like subacute thyroiditis. But yeah, so I usually don't recommend like external like creams or things like that for rashes, because we want to address the cause of the problem. And those creams, like if you go to a regular dermatologist, they'll give creams which are doing absolutely nothing for the cause. Now, I'm not saying there's never a time and place for those, but the goal is to address whenever possible the cause. Healthy gut, very important. You could definitely check out once this call is over, even now, if you wanted to go on savemythyroid.com, type in I guess Julie Greenberg, or just Julie. There's a few, I interviewed a few Julies on my podcast, but you should see Julie Greenberg, Dr. Julie Greenberg. Or you could skin conditions and thyroid health. Maybe I forgot the name of the episode, but you could listen to that conversation. But I highly would recommend attending the boot camp if you haven't done so already. All right. Again, I'm going to try to get to everybody at least once. I can't promise I will get to everybody's, like if someone has multiple questions. Again, this is going to be a shortened Q&A session, but again, the goal next week is to present a live lesson, like 15 to 30 minutes, and then have every day like 30 to 45 minutes worth of Q&A. And then there is an optional VIP upgrade for $27, where you not only get long-term access to the recordings, but then there'll be another 90-minute Q&A session where you could actually email questions or attend live. So, but even if you don't upgrade, there'll be a good opportunity to get your questions answered during the free sessions next week. All right, so Sasa, how is the correct way of taking Lugol's with PTU, bugleweed? So Dr. Brownstein's protocol. So I'm probably not the best one to answer this, just because my perspective on iodine has changed over the years. So I'm very familiar with Dr. Brownstein, and I've read his book, Iodine: Why You Need It, Why You Can't Live Without It. I actually did. I don't have him on the I haven't had him on the podcast, but years ago, like I don't know, pretty close when Natural Endocrine Solutions was, again, it came out in 2010. Not too long after that, I contacted Dr. Brownstein, and I have a blog post, like a Q&A blog post, where I just asked him some questions, and then he replied, and then I posted it. But be great to have him one day I actually invited him at a thyroid summit, and I sent him an invitation last year, and he never responded. So, again, I don't know if he would accept an invitation to my podcast, but I'm not anti-iodine. I've had good experience with iodine, but again, not everybody does well with iodine. And again, anti-thyroid medication affects the metabolism of iodine. I mean, so I don't know if you really would want to take, like again, Lugol's, like if someone's taking iodine, it's, I don't want to say replacement for PTU. I mean, it's one of those things. Iodine could increase hyperthyroidism, but also in some cases can decrease hyperthyroidism, have like that opposite effect. So yeah, again, like I said, I don't typically recommend, like I used to years ago, would have people do like an iodine loading test, and then assuming they were deficient, give recommendations for iodine, make sure they're taking selenium and some other things. But I just found that not everybody did well with that, and not everybody needs that. Arguably, most people don't need that to get into remission. I mean, if you read Dr. Brownstein's book, you'll get the impression, oh, everybody needs iodine in order to get in remission. But that's, again, that's his perspective. And maybe that's why he didn't come on the summit, because maybe you heard me say that. But it's like I said, I'm not against iodine. I'm not anti-iodine. Like some practitioners will say, completely avoid iodine if you have hyperthyroidism. I don't take that approach either. But the higher dose, like 25 milligrams, 15 milligrams of iodine, again, that's not the approach I take. Again, very familiar with it. I've done it in the past. But I found that people, again, they don't need like we want to correct any mineral deficiency, but those really high doses, I think, in most cases, I'll say aren't necessary. But again, we have differences in opinions. Different practitioners have success with different protocols. But anyway, so I'll leave it at that. All right, I'm going to wrap this up soon. Like I said, today the goal was just to kind of come on for about a half hour, answer questions. I have a lot to do for still the boot camp. I'm still not completely done with everything, and then let alone everything else I do, like the podcast and stuff like that. So it's a little bit hectic. So Word Hannah ask, is it okay to stop bugleweed after a short time? I started yesterday for hyperthyroidism, but not sure if I should continue as I felt quite drowsy after taking it for the first time last night. I mean, there's no, I've had people where I mean, most people tolerate it well, but I've had people where they just don't feel good on bugleweed and then they stop abruptly and there doesn't seem to be any negative consequences. So now, Word Hannah also mentioned here, I stopped medication. So if you're not taking anything, I mean, again, that there is that concern if you're not managing your hyperthyroidism. But so that's like two separate questions. I mean, can you stop bugleweed without negative consequences? And again, I have not seen any negative consequences of people abruptly stopping bugleweed. But if someone's not taking medication and they're not taking bugleweed, I mean, there's L-carnitine in higher doses, but that could be a concern. And then she does say, thank you so much for explaining. I am taking vitamins and so on. Okay, I think, Lynn, I don't think I answered your question. I know there are multiple questions, but again, I would say attend the boot camp next week, just because, like I said, and I have actually this afternoon, I have a podcast interview. I'm actually going to be on someone else's podcast. So it's just, had an interview this morning. It's just fun. I really enjoy it. But like I said, the goal is just to come on, remind people about the boot camp at savemythyroid.com/healthy gut. And then, yeah. And then my fear is if I start, when do I stop? I mean, again, when your numbers are looking good, like when I took bugleweed, I stopped I didn't stop abruptly. Again, my numbers started getting hypo, and then I reduced the dosage, and I think I probably mentioned this in my episode, how much bugleweed should I take? But again, it's just kind of like methimazole. When things start going hypo, the dosage is reduced. All right, so I'm gonna answer two more questions, and I'm gonna call it a day. So because we have not Word Hannah, we got I answered her question. We got Lynn and Candace. So Lynn, oh, actually, so Lynn, another iodine. Is that wait, did I answer? Is that someone else who had the iodine question before? Oh yeah, that was Sasa. Okay. So do you believe in Dr. Christensen's theory that iodine supplementation amount depends on if you were raised on the coast or inland? Good question. I don't know. I mean, I had him on the podcast, and yeah, I had him. He's a thyroid expert. I did enjoy his book. I read his book, Thyroid Reset Diet, but I'm not sure. I mean, I do think everybody's different, and I don't know if that's really the explanation why some people could tolerate higher amounts of iodine and some people can't. My guess is that there are some genetics behind it too. So I don't know about that, but I do agree that some people do perfectly fine with more iodine, where others are more sensitive and seem to do better when they're like 200 micrograms or less, which is what Dr. C is recommending for a number of people. Let me see, because we had someone else pop in with asking a question. So we'll get to, so Joyce, I'll get to yours too. So, all right. So we have Candace. So this question, how to heal the gut? It's causing constipation from the graves. Attend the Healthy Gut, Healthy Thyroid Bootcamp next week, savemythyroid.com/healthy gut. As far as shortness of breath, so shortness of breath is my major issue with this horrible disease. Any advice? I mean, you want to, there's no balancing the thyroid hormone. So like with hyperthyroidism, it's very common. And I do have some art. I might even have a podcast episode on shortness of breath and air hunger. So check out my website. So a couple of things, because you'll get a more comprehensive answer by visiting. The short answer is you really need to balance the thyroid hormones when it's related to the hyperthyroidism. But if you visit naturalendocrinesolutions.com and type in air hunger, maybe shortness of breath, but air hunger, which kind of relates to that. And then I also talk about shortness of breath, or again, savemythyroid.com. And I know naturalendocrinesolutions.com. I have an article on air hunger, shortness of breath. I think I have one on an episode on savemythyroid.com, but I'm not sure. And with the article, I'll go into other factors, but it really comes down to balancing the thyroid hormones. Now, if someone's taking a beta blocker, that could deplete coenzyme Q10. And so taking coenzyme Q10 could sometimes help as well. Hyperthyroidism itself will not deplete, but can affect CoQ10 levels. So sometimes even if someone isn't taking a beta blocker, that could help. But like I said, balancing the thyroid hormone levels, CoQ10, but then I go into much greater detail in my article. And again, I think I have a podcast episode as well. All right. And Joyce, so this is going to be the last question. And like I said, if there's any unanswered questions, definitely either way, register for the boot camp. Hopefully most of you, if not everybody, has registered for the Healthy Gut, Healthy Thyroid Bootcamp. So Joyce Ann says, does herbs affect the liver, or is it the Graves that's causing the liver enzymes to be elevated? In most cases, it's the Graves. And I actually have an episode coming out in February, I believe. Yeah, not this. I'm pretty sure it's in February, about hyperthyroidism and the liver. So meaning that like when someone takes anti-thyroid medication, that could raise liver enzymes, but the episode that I'm talking about will be focusing on the impact of the elevation in thyroid hormones itself, not medication. So I'm not saying herbs can never affect the liver, because sometimes they can, but hyperthyroidism definitely can affect the liver. So if someone has hyperthyroidism related to Graves or toxic multinodular goiter, let's say, that by itself can cause the AST, ALT, liver enzymes to be elevated. Alkaline phosphatase, when that's elevated, that's related to the bone turnover. A lot of people see elevated alkaline phosphatase and are like, oh, my liver is really being affected. But that's more the bone turnover. It's the AST and ALT you want to look at on a liver panel, hepatic panel, or comprehensive metabolic panel. How much is the boot camp? Boot camp is free. So boot camp completely free. When you register, it'll then take you to a VIP upgrade page, which is completely optional. If you hit that page, that means you're registered for the free boot camp. And then the VIP upgrade is $27. And that's it, just if you want longer term access to the recordings, and then that extra one-on-one session, or not one-on-one session, extra group session, like group Q&A call, 90-minute Q&A session, kind of like this, but where I'll go longer, and also I will answer questions that are emailed to me as well. So, but again, once you register for the free boot camp, you'll get that information on the VIP upgrade. All right. Yeah, yeah, definitely free. You are welcome, Word Hannah. Karen, thank you, Dr. Eric. Looking forward to the boot camp. You are welcome. And thanks, Karen. Thanks for everyone for joining and for your questions. Yeah, I look forward to seeing you at the boot camp. Joyce, you are welcome. Thank you. And Word Hannah, I will sign up for VIP also. Okay, cool. Well, thank you. I appreciate it. So yeah, that's again, usually with the VIP, I've done this in the past. We usually get maybe 50 or so people that sign up, and usually I'm able to answer most, if not all, questions, just because it is a smaller amount. Like with the free boot camp, again, there's right now 700 plus people registered. So by the time Monday comes around, there's probably going to be maybe not quite 1,000, but at least 900 registered. So, and feel free, join the Facebook group. Like I said, there's 700 plus people registered, but only 50 something people in the Facebook group. And we've had a lot of people. There's an introduction post and people responding to the introduction post, which you'll see if you join the Facebook group. And yeah, and unfortunately, Shannon, I do not know. I am not familiar with the naturopath functional medicine doctor in Jamaica. I mean, you could visit the Institute for Functional Medicine. I think it's IFM.org, or if you just do a search, Institute for Functional Medicine, and you might, again, they have listings of people who are not just in the United States, so you could do a search and see. I mean, it might be like if you have Graves, hyperthyroidism, you might not find someone who's specific, but even in the United States, that could be challenging. So, Word Hannah, need the help. Look forward to it. Yeah, I look forward to it too. Look forward to seeing you and everybody else. The Facebook group name, I mean, it's Healthy Gut, Healthy Thyroid, or Healthy Gut, Healthy Thyroid Bootcamp, but I do a check, like an email check. So like in order to join, you have to be a member of the bootcamp. So definitely register for the free bootcamp first, because when someone joins the Facebook group, I'll ask the question will come up, what email did you use to register for the bootcamp? And then whoever accepts you into the Facebook group will check, make sure you register, because we don't want people just randomly in there who aren't benefiting from the Facebook group. So yeah, so but it's like Healthy Gut, Healthy Thyroid Bootcamp. And Shannon, you're welcome. Word Hannah, you are welcome. Thank you, everyone. This was great. Again, sorry it's short, but like I said, just have a lot to do with still with the boot camp, still working on some of the presentations, still honestly doing with some of the later ones, like later in the week, just still updating and doing some research. But yeah, so and you get, when you register, there's also pre-training videos, so you get actually immediate content with that as well. So yep, see you soon, everyone. Have a great rest of your Friday, great weekend ahead, and hope to see most of you, if not everyone, at the Healthy Gut, Healthy Thyroid Bootcamp starting on Monday. Again, savemythyroid.com/healthy gut. All right. Take care, everyone. Thanks again for your questions and for your support. Appreciate it.